Hi everybody, in this video I'm going to try and demystify myths which are very prevalent with the general population. This is Dr. Ravindran Kumeran from Apollo Firstment Hospitals, Chennai. I am a surgical gastroenterologist and I hope this video is useful. This video is going to be about what people commonly perceive about, for example, hernia, right? The particular topic which I've chosen today is hernia, right? Now often people think that you do not have to do anything about a hernia until it gives rise to a problem. Now that is invariably an emergency. So that itself is a wrong concept, right? The idea of doing the operation is to try and prevent complications. So if somebody is going to wait to have pain or unbearable pain or vomiting, then it usually means it's a complicated hernia. So the general advice is, if you have a diagnosed problem such as hernia, which is a very simple problem, try and deal with it when you do not have symptoms at all, so that your operation can be a planned operation. You can decide where, when, who operates on you, what type of surgery, whether it's going to be open, whether it's going to be laparoscopic, sometimes even robotic. That will be to your advantage. You can plan your holidays, you can plan your recovery, and so on and so forth. And usually results for any surgery, especially to do with hernia, is invariably better if you do it as a planned operation rather than emergency operation, where the priority will be entirely different. The emergency operation by itself means that there is something more going on in the system. For example, if there is a little loop of bowel stuck within your hernial sac, then the priority is to protect the bowel, preserve the bowel, and that is where the onus of the operation goes on. So the hernia itself, the hernia part itself is relegated to number 2. So invariably the results are bad in the long run. So please, as a request to the general public, if there is a hernia which is properly diagnosed by a surgeon, then you have to plan it at your convenience and deal with it before you have any serious symptoms associated with it. And in that way, you would have the best possible results in the long run. Thank you.